Well, welcome to this instructional video on how to care for children that have had gastrostomy tube insertion. Our intent here today is for you to understand how to care for this device at home, and I think that this will really help facilitate the care of your child. The placement of a gastrostomy is often required for several conditions, primarily for children who are unable to swallow or for whatever reason are not taking in enough nutrition on their own. So having a tube that's directly into the stomach enables one to feed into the stomach and make up for what the child is unable to take on their own. Other situations for having a gastrostomy include draining the fluid that might accumulate within the stomach to prevent the child from throwing up, and also keep them from having to have a tube down the nose to either deliver nutrition or to drain the fluid from the stomach. The care of your child with a gastrostomy involves many different individuals with various responsibilities. So you will have an exposure to nurses at the bedside, nurse practitioners, attending surgeons, as well as residents and fellows. All of them have various responsibilities and contribute to the child's care. We welcome any questions that you have to anybody along the way because we are a team. We all want to be on the same page, so any of your questions are quite welcome.
Welcome to our program. In this program, we'll demonstrate how to deliver nutrients and medications through the tube and how to apply a dressing to the site. You may choose to watch all segments in order or focus first on the specific topics you feel are priorities. We encourage you to replay specific material as often as needed. We also suggest that you share it with others who may be involved in your child's care. Also, refer to the guide you received from the surgical team for more detailed information about your child's appliance. We have a lot of information to cover, so let's get started.
The placement of a gastrostomy is essentially putting a tube into the stomach. This is a surgical procedure, and one way to do this would be to make a small incision in the abdomen and place the tube under direct vision into the stomach and then bring the tube out separate from that incision. Another would be to use various laparoscopic techniques whereby the stomach can be visualized inside the abdomen and a tube can be placed directly into the stomach that way. And sometimes it's a blind approach where we inflate the stomach with a scope that's inserted into the stomach itself, and then through a needle and a series of dilators we can place a gastrostomy that way. There are two basic types of tubes. One is a longer tube, and one is called a button, which is more at the skin level. Sometimes a button can be placed up front as the initial operation, and sometimes a longer tube is placed, and that can be switched over to a button in children in whom that's an appropriate option.
The gastrostomy appliance is inserted into the stomach after it passes through an opening made in the skin, fat, and muscle layers of your child's abdomen. This opening in the skin is called a gastrostomy tract. Your surgeon will decide what appliance is best for your child based on your child's anatomy. The surgical team will provide more specifics regarding your child's particular appliance. There are several gastrostomy appliances available on the market, but in this video, we will only discuss the button appliance. The majority of buttons placed at St. Louis Children's Hospital are called Mickey buttons. Your child's surgeon will select the size of the button based on your child's size. The size will be listed on the button. The label FR stands for French. French refers to the diameter or thickness of the tube. The CM stands for centimeters and refers to the length of the button. As your child grows, he or she may need a longer button that can be sized and changed in the pediatric surgery clinic. You'll find more detailed sizing information in your teaching tool. Please refer to it as needed. At the bottom of the gastrostomy appliance is a balloon that helps keep the appliance snug against the stomach wall without falling out. The balloon is usually filled with 5 milliliters of water. Your surgeon may decide to fill the balloon with less or more water based on your child's anatomy. Following surgery to insert the button, your child will need rest, pain management, IV fluids, and sometimes IV antibiotics. Your child will come out of the operation and may still be a little sleepy from anesthesia. This is normal. For the first 24 hours after surgery, your child's button may be connected to a small plastic container. This allows any stomach contents to drain out. Even without eating or drinking, the stomach normally makes juices. Draining these fluids prevents the stomach from getting too full after surgery. Usually, your child will not take in fluids by mouth or by the button for the first 12 to 24 hours after surgery. This helps relieve nausea from the anesthesia and allows surrounding tissues to begin healing. It will take about 6 to 8 weeks for the gastrostomy tract and the surrounding tissues to heal completely. Your child will be allowed to have some medications through the button or by mouth in those first 24 hours. After surgery, the surgical area may be tender for several days. It can also be normal to see drainage around the button. The nurse will check your child frequently for pain and discomfort after surgery and will give pain medications as ordered by the surgeon. The nurse will also check for heavy drainage around the button and will monitor the amount of fluid draining from your child's stomach. The container will be disconnected from the button once the surgical team determines your child is ready. You may notice sutures or stitches around your child's gastrostomy appliance. These are used to anchor the device to your child's skin. Later in your child's postoperative recovery, sutures around the appliance will be removed. This usually causes very little pain. Once your child is discharged from the hospital, you'll need to continue care at home. As with every medical device, there are some simple guidelines that should be followed in order for the gastrostomy appliance to continue to work properly. First, it is important to prevent the gastrostomy from being accidentally pulled out. In order to prevent this, you may dress your infant in a onesie or place an ACE wrap bandage around the abdomen in active toddlers and children. Before your child goes home, you will be given instructions about a diet and feeding schedule that deliver the calories and fluids your child needs. There are 2 forms of feedings. One form of feeding is done using gravity. The other uses a mechanical feeding pump. We'll cover each of these in a few moments. But first, some general guidelines. If the feedings are given too fast, your child may feel crampy belly pain, retch, or vomit. When giving feedings, remember to do it slowly. You may place your child in a safely secured infant seat, wheelchair, or chair during feedings. Your child may also lie on his or her right side if getting fed at night, which may help to empty the stomach. In order to give feedings, medications, or water through the button, you will need to know how to attach the extension tubing to the button. Since the button has a one-way valve, feedings should not leak out when the plug or tab is open. Here are steps for connecting the extension tubing. Fill the extension set with water or formula prior to attaching it to the button. This prevents inserting air into your child's stomach. Lift the plug or tab out of the button. Hold the button in place with one hand. With the opposite hand, take the extension set and line up the black line on the extension set with the black line on the button. Gently push the extension set into the button. Turn the extension set clockwise, at least 1/4 turn, to open up the valve and secure the device in place. Now it is ready to be used for giving meds, feedings, or water flushes. When not using the extension set, it should be disconnected from your child and cleaned with soap and water. Rinse and air dry. Do not ever boil the tubing or place it in the dishwasher or microwave. Remember, buttons should be flushed with 5 to 10 milliliters of water after every feeding and after giving medications. It should also be flushed once a day, even when not in use, to prevent clogging. Take time to nurture your child during feedings. This is an important time to continue to provide your child with pleasant sensations and opportunities for bonding. This may include holding, rocking, and talking to your child during feedings. To deliver a gravity feeding, assemble your supplies first. You'll need formula, a feeding syringe, water for flushing, and an extension set for the button. Once you've assembled your supplies, follow these steps. Wash your hands. Attach the extension set to the button. Remove the plunger from the syringe and attach the syringe to the extension set. Pour the formula into the syringe and hold the extension set at the level of your child's stomach. Open the clamp on the extension set. Raise the syringe until the formula flows in slowly. You can decrease the rate by lowering the syringe if needed. Formula should go in over 15 to 20 minutes. The formula may come back into the syringe if your child is fussy or crying. Just wait a few minutes, and then the formula will go in again once your child calms down. When the feeding is complete, flush the extension set with 5 to 10 milliliters of water. Clamp the extension set and then disconnect the extension set by turning at least 1/4 turn counterclockwise. The black marks will line up again with each other. Then remove the extension set by holding the button and gently pulling on the extension set. Then wash supplies with soap and water, rinse, and allow to air dry. Feedings delivered through a mechanical feeding pump can be continuous during the day or night, or they may run over several hours. To deliver a feeding using a mechanical pump, assemble your supplies first. You'll need a feeding pump, tubing, bags, formula, feeding syringe, water for flushing, and an extension set. Once you've assembled your supplies, follow these steps. Wash your hands. Pour the amount of formula needed into the feeding bag. Open the clamps of the feeding bag. Fill the tubing with formula. This is called priming. Then close clamps when the formula reaches the end of the tubing. Place the pump tubing into the pump and then attach extension tubing to the gastrostomy appliance. Depending on the type of pump your child has, your pump may look different than this one, but it operates the same way. Your home health company will review your specific pump with you. Open the clamp on the extension tubing and pump tubing. Check the rate of the pump. Start the feeding pump. Your child's feeding will then run over the number of hours your doctor has instructed. At the end of the feeding, clamp the extension set and turn off the pump. Remove the pump tubing from the extension set. Attach the feeding syringe to the extension set. Pour 5 to 10 milliliters of water into the syringe. Open the extension set clamp and allow the water to flow in, and then clamp the extension set. Then remove the extension tubing and close the button. In order to prevent pulling on the button during feedings, you'll need to tape down the extension set. Before you get started, assemble your supplies. You'll need scissors, skin wipes, also known as skin prep, soap, water, towel, and tape of your choosing. Once you've assembled your supplies, follow these steps. Wash your hands. Clean and dry the area on your child's abdomen where you will tape the extension set. If your child's skin is irritated, your surgery team may order a special dressing, known as Duoderm. Wipe a skin prep pad on skin where the tape will go and, if needed, where the Duoderm will go. After the skin prep gets sticky, lay the extension set on the skin prep and cover it with tape. Remember to move to different spots to help prevent skin breakdown. When your child must receive medications through the button, ask your pharmacist to dispense all medications in liquid form if possible. Ask the pharmacist whether you can crush the tablets or open the capsules yourself if a liquid form is not available. Then dissolve them in water before delivering them through the gastrostomy appliance. To give medications through the button, follow these steps. Connect the extension set to the button as previously instructed. Be sure the feeding port is closed when using the medicine port. Put the medicine syringe into the smaller port. Unclamp the extension set and slowly push the medicine into the button. Clamp the extension set, then disconnect the medicine syringe and close the med port on the extension set. Open the med port and attach the syringe with 5 to 10 milliliters of water for flush. Unclamp the extension set and push in the flush, and then clamp the extension set. Remove the syringe and close the med port. Remove the extension set and plug the button. Finally, wash the extension set with soap and water, rinse, and let air dry. Most children who have gastrostomies can burp or pass gas on their own to relieve the excess air in their stomach. However, some children have problems doing this. When this happens, you can help relieve gas from your child's stomach using a venting technique. Follow these steps below to use the venting technique using a syringe. Using a syringe, clamp the extension set and attach it to the button. Take the feeding syringe without the plunger and attach it to the extension set. Hold the syringe about the level of your child's stomach and unclamp the extension set. You will see excess gas will bubble up into the syringe. It is not uncommon to see formula or stomach juice rise into the syringe. Once the gas is relieved, allow the formula or stomach juices to slowly flow back into your child. Your child may have an anti-reflux procedure performed. If this is the case, your child's medical provider may order a feral bag. To learn more about the feral bag, click on the link provided. You may also refer to your feral bag teaching tool. As with any surgical site, it is important to keep the skin around the gastrostomy appliance clean. You should clean around your child's appliance with soap and water at least 3 times a week. Rinse the area well and then pat dry. Check the site daily for redness larger than the size of a quarter, swelling, tenderness, skin irritation, rashes, or drainage and leakage around the gastrostomy appliance. If any of these occur and last more than 24 hours, please call the surgery office. Remember, do not rotate the appliance unless it is causing pressure on the skin. Rotating the device may cause the site to become bigger and develop granulation tissue. Granulation tissue is pink, fleshy tissue that forms in the healing process. If you notice drainage or redness, you should clean the area more frequently. Young children should only have a sponge bath for the first 1 to 2 weeks. Older children may shower for the first 2 weeks. This helps to protect your child's surgery site. After 2 weeks, both younger and older children may have baths. Gastrostomy appliance sites rarely get infected, but leaking can commonly occur. A dressing may not be needed unless the site is leaking, or you are instructed by the surgeon to place a dressing at the gastrostomy site. Bath time is a good time to change the dressing. Unless there is a lot of drainage, buttons usually don't require dressings. However, if there is a lot of drainage, you will need the following supplies: a washcloth or Q-tip, soap and water, stoma adhesive powder, a split 2x2 gauze, tape, and scissors. Once you have gathered your supplies, wash your hands. Clean the skin around the button with warm, soapy water. Rinse the area and pat dry. Sprinkle stoma adhesive powder around the button if there's lots of drainage. Place a 2x2 gauze with a split under the button. Then place a piece of tape to cover the ring, gauze, and skin. If you notice excessive leaking around your child's button and your child has had the device for less than 2 months, please call the surgery office for instructions. If leaking comes from the valve, then the button has malfunctioned. Keep the button plugged to prevent leaking of fluid into your child's skin. Then call the surgery office. When stomach secretions leak onto the skin around the gastrostomy appliance, it can be very irritating to the skin and cause it to break down or turn red. Several products are available to help protect your child's skin. Stomadhesive powder is the most commonly used product. It's used to help absorb some of the drainage while protecting your child's skin. Here's how to apply it. Just sprinkle stomadhesive powder around the gastrostomy daily after bathing your child. You may also use a piece of gauze over the powder to absorb additional leakage. Stomadhesive powder can be sprinkled around the button and will not hurt your child if some of the powder goes into the gastrostomy appliance or stomach. Moisture may cause a rash. If the bumps or rash do not clear up after using stomadhesive powder, call the surgery office. There are other dressings available to help with irritation. Call the general surgery office for advice on other products that can be used. Children can develop granulation tissue around the gastrostomy site. This is extra tissue that grows around the gastrostomy. You cannot always prevent granulation tissue from forming. The tissue contains many capillaries or small blood vessels that make it look red or pink. It looks just like the gums in your mouth. Do not worry if you see these tiny spots of blood or if the tissue becomes irritated. Granulation tissue is not an infection, but can sometimes have yellow drainage. Granulation tissue may go away on its own, but it may also need to be treated. Call the general surgery office if the tissue becomes tender, drainage increases, or it's causing the gastrostomy appliance to fit improperly. A nurse or nurse practitioner can order a small Q-tip with medicine called silver nitrate to be applied to the tissue. The medication helps the tissue shrink and dry up. After it's applied, it can make the tissue look gray or white. Gastrostomy appliances, on very rare occasions, may come out. There is no immediate danger to your child. Formula or food may leak from the site, or you may see a small amount of bloody drainage. If your child's appliance comes out within 2 months of surgery or before the first gastrostomy change, you'll need to take several steps. You will be sent home with a take-home bag and 2 replacement tubes called Foley catheters. One that is the same size French as the one found on your child's button, and one that is 1 size smaller. Make sure to keep these items in a handy location at all times. When you find your child's gastrostomy appliance has come out, cover the opening with a washcloth. Do not put the button back in. The reason is that the end of the button is blunt, which may push your child's stomach away from the abdominal wall. Next, assemble your supplies. You'll need a Foley catheter, a washcloth, water-soluble lubricant, tape, a measuring device, and scissors. Take a deep breath and try to relax your child. Get the Foley that is the same size as your child's button. Put a small amount of water-soluble lubricant on the tip of the Foley. If your child's weight is less than 15 pounds, gently insert the tip of the Foley about 1 1/4 inches or 3 centimeters. For children who weigh more than 15 pounds, insert the Foley into the gastrostomy tract about 2 1/2 inches or 6 centimeters. Your child may cry, wiggle, or kick, which can cause the abdominal walls to tense. Try to relax and comfort your child. When your child breathes out, the abdominal muscles will relax and the Foley catheter should slide into the opening. It is important to remember not to force the Foley into the hole. If you are unable to get the Foley catheter in, try the next size smaller. Do not take more than 10 to 15 minutes to try to insert the replacement tube. Once the Foley catheter is inserted, tape the tube to your child's abdomen. Do not blow up the balloon on the Foley. Also, do not give any water, medicine, or feeds through the tube until cleared by a general surgeon. You will need to take your child to St. Louis Children's Hospital emergency room. You should call the surgery office or the pediatric surgeon on call to let the ER know you are coming. If you are unable to insert the tube, take your child to your nearest emergency room. If you live outside the metropolitan St. Louis area, have the local emergency room physician call the surgical resident at St. Louis Children's Hospital. You can reach the surgery office or the surgical resident on call 24 hours a day. If your child has had the gastrostomy appliance less than 1 month, you should call the pediatric surgery office if your child has a swollen, hard, or bulging stomach, has purulent, bloody, bright green, or brown drainage that smells like stool coming from the gastrostomy appliance, is throwing up his or her feedings, has pain or cramping with his or her feedings, is crying without tears, has a dry mouth or cracked lips, if your child is an infant and has a sunken soft spot on his or her head, is sleepier than normal, is complaining of dizziness, if your child is an infant and has not had a wet diaper in 8 hours or has no urine in 12 hours at any age. Here are some frequently asked questions. Please refer to this list. If you have a question that is not answered, please contact your doctor or the surgery office. If my child has a gastrostomy, how does this affect normal mouth care? It is important to remember to continue wiping off your child's mouth and brushing your child's teeth, even if your child may not take medicines or food by mouth. We recommend that you give mouth care at least twice a day. Can my child swim or bathe? After 1 to 2 weeks, your child's gastrostomy appliance should be healed and your child can bathe or swim in chlorinated water. After 4 weeks, your child can swim in lakes, rivers, or oceans. Clean the gastrostomy site immediately after your child returns from swimming. Water may leak into your child's stomach. This is okay for most children, unless your doctor advises you otherwise. Can my child lie on his or her gastrostomy appliance? Yes, once the site is no longer tender. Infants may lie on their stomachs for tummy time. Older children may sleep or lay on their stomachs as tolerated. Does my child have to go back to surgery to remove the gastrostomy appliance? No, most gastrostomies are removed in the general surgery clinic, and most close up in several weeks. Some leaking from the stomach is normal after removal of the gastrostomy appliance. The nurse in the surgery office can show you how to put a dressing over the old gastrostomy site. However, your child may require an operation to close the opening if the gastrostomy was in place for a long time. How do I clean the equipment? Clean the attachments and syringes with soap and water. Rinse well and allow them to air dry. Do not put any of the attachments or syringes in the microwave or dishwasher. What is granulation tissue? This is a tissue that may grow at the opening of the gastrostomy and is a normal occurrence. It is a pink, red color, moist, and looks like the tissue of your cheek on the inside of your mouth. The tissue contains many capillaries or small blood vessels. When it is irritated, it is common for this tissue to bleed. Granulation tissue can also produce a yellow drainage. This is not considered an infection. Granulation tissue is not harmful. Granulation tissue cannot be prevented. Granulation tissue sometimes goes away on its own. However, if it becomes a problem, please contact the surgery office. We hope this program has been helpful. If you have additional questions, contact your child's doctor, 314-454-KIDS, or the surgery office at 314-454-6022. You can also learn more by logging on to our website.